Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey, everybody. Welcome to the Gastro Girl podcast. Today's topic is about managing chronic pain from digestive distress. If you're having a tough time with your tummy, my guest today is here to help give your gut some love. Joining us today is Dr. Mark Weisberg, a board-certified clinical health psychologist in Minneapolis, Minnesota. His clinical practice focuses on integrative mind-body medicine and treatment of chronic physical conditions. He is the co-author of a book on integrative treatment of digestive disorders called Trust Your Gut, Get Lasting Healing from IBS and Other Chronic Digestive Problems Without Drugs. That's a great title for a book. So welcome, Dr. Weisberg. So great to have you on the show today.
Thanks. Nice to be here.
Nice to be here. Nice for you to be here. I'm nice for me to be here too.
I think you're already here.
Well, that's debatable. We would like to understand what chronic pain is and how chronic pain works in relation to digestive health conditions such as IBS. Can you give us a little 101 on that?
Sure. So I think it's important, to understand chronic pain. It's helpful to distinguish it from acute pain. We can forget sometimes that pain is actually our friend. Pain helps us survive. If you put your hand on a hot stove, pain's that signal to protect your hand. And in the short run, acute pain, things that happen recently, like if you have broken your leg or twisted an ankle or put your hand on a hot stove, that acute pain, meaning pain that's of more recent origin, will give you a signal that something's wrong and you need to take action. And typically, whatever action you take is going to help. You break your leg, you put a cast on it, you set the leg, you take some Tylenol, and in a few weeks it's better. You burn your hand, you add some ointment and do some other things, and it's better in a short period of time. Chronic pain, by contrast, is defined in the medical literature as pain that lasts at least 3 to 6 months or more in duration. And this is an important distinction because when pain has lasted 3 to 6 months or longer, our nervous system actually changes. The central nervous system, which consists of the brain and the spinal cord, change in that it starts to become sensitized. The nerve pathways that are sending and receiving these nerve signals, if the signals are sent for a long enough time, the nerve channels can actually become physically altered and can become sensitized so that something that's painful now starts to feel more painful than it was before. And sometimes things that don't hurt at all will now start to be painful. An example would be for some, and we call this sensitizing of the nerves central sensitization.
Oh, wow.
And when central sensitization kicks in, for example, if you have central sensitization and you have a hand that doesn't have pain and someone brushes their hand over it, it might be in pain because their system has become sensitized. And this happens in the central nervous system. There's also another branch of the nervous system that's called autonomic, which means automatic. Yeah. And there's two branches. There's kind of the activating branch called sympathetic, and there's the calming branch that's called parasympathetic. When these are in balance, we feel pretty good. When they're out of balance, then any problem we have gets intensified. So if the issue is you've had digestive pain that's lasted more than 3 to 6 months, your autonomic nervous system is likely going to be out of balance between the activating and the calming part. And that also serves to make the pain more intense, more troubling, last longer, more difficult to treat.
That's so interesting. So interesting. So is that what happens with IBS patients and their chronic abdominal pain, for instance?
Yes. When someone's had IBS for greater than 6 months, that is what happens. One of the hallmarks of people who have IBS is something called visceral hypersensitivity, which is a fancy term that just means that the viscera of the abdominal area starts to become hypersensitive. When they place a balloon in the rectum of someone who has IBS and they inflate it, the IBS patient will describe pain and distress at much lower inflation compared to people who don't have IBS.
Oh, interesting.
So the nerves and tissues of the entire digestive tract can become more sensitized and painful when it gets to be longer than 3 to 6 months.
Very interesting. So How does extended periods of chronic pain affect patients?
Well, a number of ways. One is what I would describe as the difference between pain and suffering. So in the pain medicine literature, we describe pain, meaning what a term we might use called nociception, which just means the actual nerve signal of pain distress. So if you, again, using the stove analogy, if you put your hand on a hot stove, it's nociceptive signals from there up into your brain and back that helps you feel it. But in addition to the pain, there's also what we call the secondary reaction, which is the suffering, which are all the myriad of reactions that we have in response to the pain. So when you've had pain for 6 months, if you've had bloating, cramping, belly pain that's lasted more than 6 months, part of what happens is that when you get a flare of the pain, it's not just the initial pain signal. It's all the reactions that come right in reaction to it. It might be, oh no, not this again. Or,
Right.
oh, is this going to be worse than last time? What if I can't find a bathroom? What if this keeps me from going to work tomorrow? What if I miss my friend's wedding next week? Damn it, I'm so mad that this has happened again. And then anxiety, anger, agitation, all that happened in response to that initial sensory signal, which commonly becomes a part of when the pain's chronic.
So it's like all that anticipatory anxiety builds up around that.
It's anticipatory, but it's also in reaction to as well.
Yeah.
So it's anxiety before the pain and anxiety after the pain as well.
Oh, wow. These poor patients. So
Yeah.
goodness gracious. So why doesn't normal pain relievers or narcotic pain medications help for chronic abdominal pain?
So here again, the medications that are used to reduce pain can work fairly well with acute pain. If you've had a recent injury or a recent problem, it's far more likely that ibuprofen or nonsteroidal anti-inflammatories or Tylenol and related things may provide relief in the short term. Opioids are commonly used, particularly post-surgery. If someone's had a tooth extraction or had a knee surgery or a hernia surgery, something like that, it's not uncommon that opioids might be prescribed for 2 to 3 days afterwards. There's a few problems, though, here again, once it becomes chronic. And one is that these medicines don't address all those other secondary reactive factors that happen. When you get discouraged or angry or upset about the fact that your belly hurts again, that agitation also revs up your nervous system and causes a further imbalance in the autonomic nervous system. Medication does not treat that effectively, number one. Number two is that the longer that you start to use medications over time, there's a couple of problems that can result. One is tolerance, meaning that it may take more and more of a higher dosage of a medication to get the same relief.
Yeah.
The bigger problem is what's called analgesic rebound, which means that certainly among the narcotic medications, and even among some of the non-narcotic medications, the ibuprofens and the Tylenols, is that when you take it over an extended period, the very medicine that is supposed to reduce your pain may actually increase it.
This is so fascinating. This is so fascinating.
Yeah. And I would tell you that at the pain clinic, where I was a co-owner and worked for over 32 years, I'd say about at least a third of the patients that we saw, both for abdominal pain and for other back pain, headaches, stuff like that, about a third of them were suffering with some degree of analgesic rebound. And so one of the things we had to do was teach them a whole bunch of other non-medication methods to be able to start to bring the pain levels back down as they were phasing off of these medications that were making their pain worse.
God, I wish you were around. You are around, but when you hear about what's happened with the whole opioid epidemic and people just going to those pain clinics or getting more and more, it's like they didn't address any of the other things you just said, and they're not responding anymore. It's making it worse, and now they're having addiction too.
Yeah, and I would add that most prescribers are well intended.
Yes.
And most patients are well-intended. So if someone's listening to this who is taking chronic opioid medications, this is not to say, this is your fault because you took the medications too long. Many people got on these medications unknowingly because they had a tooth extraction, or they had a knee surgery, or they had something else, and they were started on this, and then it just continued. It's just that now we have to bring this heightened awareness to the problem.
You're exactly right. And we're so excited to, again, highlight the fact that you did an amazing course for GI On Demand.
Thank you.
That really takes patients and providers through these issues that we've just touched upon here. And I also want to talk a little bit about, you have this core concept in your book that you wrote. Can you explain a little bit about that? Because I think it definitely relates to what we're talking about. And I think it's very fascinating.
Sure. The core concept that I wrote about in my book, Trust Your Gut, refers to 4 organizing concepts. The acronym stands for centering, observe, restore, and ensure. Most patients with chronic abdominal pain have tried their best to find good help, and most of their providers have tried their best to offer it. But it's been an acute pain model. Let me give you this medication or this intervention for your pain, and not looking at the other factors that maintain and worsen chronic pain. So we know that the key, I'm not saying that medications don't have a role, because they can, but ultimately what's going to empower the patient with chronic abdominal pain to get better is learning skills to care better for themselves and to downregulate their nervous system. I co-wrote an article in the British Medical Journal that was called "Why Pills More Than Skills?" Because we know for chronic illness, and not just chronic abdominal pain, but for all kinds of chronic conditions, we know that helping patients learn proper self-care is what's going to be the most powerful treatment of all. So centering, the first step of the core, refers to quieting down enough that you can actually sit still. Because if you're too wound up and activated, you can't even pay attention to what the body's trying to tell you. And so it talks about strategies for that. The O stands for observe. And what we know is that lots of patients with chronic pain and chronic digestive distress, especially, do what many people often do, which is when something hurts us, and it has for a while, our tendency is to try to forget about it, or think about something else, or distract ourselves with what we need to do during the day. And meanwhile, our body, one central tenet of integrative medicine is that, guess what? The body isn't stupid. And because of that, the signals are intelligent information trying to get our attention. So observe has to do with a bunch of strategies of, if I sit with this pressure, discomfort, a dull ache, what's that like? Does it spread? Does it move? Does it stay there? Does it get less? Does it get more? Do I feel restless as I do it? Oh, is there gas then with it? Because what most people will say, well, Dr. Weisberg, I'm paying attention to it 24/7. But what that really means is they notice it for 2 seconds, then they start obsessing, thinking about, what am I going to have to be hassled with because of it? So observing the sensations in your gut, observing your diet and making wise dietary choices, observing the different levels of stress you encounter, because we know that stress is not just a psychological concept. It's a very real physiological phenomenon that is important in reducing digestive pain, reducing your schedule, reducing your pacing. Observing these things is really important to be able to make good choices. And then the next step, R, is for restore, which is a number of different types of techniques and approaches that I teach for how to soothe the stress, how to calm the central sensitization and the autonomic imbalance in your nervous system. Involves anything from learning breathing techniques. Research tells us that clinical hypnosis, rather than making you bark like a dog, it turns out that it's actually scientifically been proven to be very, very effective for reducing abdominal pain. Learning those strategies. learning grounding techniques when you feel anxious or upset, learning proper schedules for mild exercise, learning proper posture and how you hold yourself in space so as to not add muscle tension to the things that are involved. Those are just some of the examples. And then the E, the last of the 4 letters, stands for ensure, which is really about relapse prevention. How to take these self-care habits and make them part of your lifestyle. Because one thing that we know for sure from years of seeing chronic pain patients is that the patients who do best, who describe the best relief from their chronic pain, no longer think of these relaxation exercises or self-hypnosis or physical exercise or et cetera as a chore on a to-do list. Instead, it's just become part of their daily life, just like brushing your teeth. And the patients who view it that way have had the most success long-term in reducing their pain.
This is wonderful. And everything you've said goes so nice with, we've interviewed recently Dr. Tara Cousineau, who talks about kindfulness and mindfulness and how just like some of the exercises, we talked to Dr. Megan Reel about diaphragmatic breathing. So we have a nice suite of courses, including yours. What would you recommend to patients and providers to take this course on understanding and managing chronic pain and digestive distress?
That's a good question. So a couple of responses. One, interestingly, there were some articles published actually in the physical therapy literature over the last few years that showed in well-designed studies that patients with pain who were even given a didactic intellectual understanding of what they were dealing with, that education alone without any other intervention decreased their pain. So we know that getting, for someone who suffered for years from gastritis, reflux, bloating, cramping, gas, motility problems. For many people, part of the distress is just not understanding exactly why is this going on. They've been to well-meaning providers who tell them, well, I don't see Crohn's disease. I don't see tumors. I don't see inflammation. So I guess you have IBS, so go relax, basically is the message. And, my gastroenterology colleagues are very concerned about this because they want so much to help, but they kind of feel for the most part like once they've ruled out other pathology, they don't have much left to offer. But there is a lot that can be done, in fact. And so who should take this course is either anyone who's suffering from digestive distress of any sort that's chronic, anyone who has other kinds of chronic pain. It might not be only digestive, they might have headaches or back pain. It's just as applicable to that. Also, family members and loved ones who are very involved in the lives of their spouse, son, daughter, parent, cousin who has this digestive pain. This will be very helpful information for them. I think also there are some practitioners who may not specialize as much in digestive disorders, and they might find the information in this useful for their patients as well.
This is great. And, it's so important for listeners and our patients out there. You're not alone. It's not in your head. Pain is real. But like Dr. Weisberg said, it's once you understand, knowledge is power. Once you understand what's happening, it's almost like a sense of relief. At least you can manage it better when you understand it's not in your head. And once everything else is ruled out, there are tools, there are ways that you can manage this and not feel like you're alone and without any help here. So we really encourage our listeners to check out Dr. Weisberg's course on GI On Demand, check out the other behavioral health or GI psychology courses on there. Many of them are free and they're very helpful. As always, thank you so much for joining us. And listeners, thank you for joining us. Don't forget to rate and review us on your favorite podcasting app so we can continue bringing you this great content featuring experts like Dr. Weisberg and awesome patients who have their health journeys to share. So thank you very much.
My pleasure. Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.